I got into acupuncture about 10 years ago now. At first I just really enjoyed what I was doing and being of service to the local community and seeing who and how I could help people. My journey into working with addiction and treating in the lines of that industry is, I suppose it's a little bit more personal. I witnessed a lot of addiction in childhood, and I think a lot of us have had it around us for a while. Working with these people and seeing the change and the transformation that occurs, not just on the superficial level of seeing the habit go away, but also resolution of all of the emotional underlying stuff that kind of really drives a lot of that behaviour. It's quite profound. I think with any interpersonal kind of treatment, the biggest challenge is always going to be met on an individual basis, depending on personalities and where people are at in their journey. But I mean, that can also be part of the greatest reward when people have those breakthroughs and they really do get what they're going into. I would say that every acupuncture session can be different. If you're worried about needles, they're not that big, they're quite small. If you're worried about pain, we can always change the level of sensation of input that I suppose we're going for. The Bardo provides a very unique, I suppose, treatment intervention style. The whole model is very holistic, from the food to all of the alternative therapies that are offered. But I think what really sets it aside is the one-on-one therapeutic basis. It's a very high ratio of staff to clientele, and then the service that the clientele receive, it's more on a personal, empathetic basis where you're seen as a person as opposed to diagnosed in a chair.